If menopause is the moment, then what comes next? Today we're talking about the decades after and how to future-proof your health, protect your brain, strengthen your body and nurture intimacy that grows richer with age. Dr. Kelly Casperson returns to help us translate science into strategy so you can feel good, think clearly and live joyfully well into your 50s, 60s and beyond. Welcome to All About You. I'm Dr. Shauna Watts, GP and women's health advocate. Every week, I share evidence-based conversations that help you navigate the changes of midlife with clarity and confidence. Today, we're continuing our conversation with urologist and author Dr. Kelly Casperson about her book, The Menopause Moment. By the end of this episode, you'll understand the link between hormones and longevity, why muscle, sleep, and protecting your bones are the non-negotiables of midlife vitality, how sex, relationships, and joy impact your health span and quality of life. And as always, remember this is general information only, not personal medical advice. Always consult your own healthcare provider for guidance. While we're talking about the brain, I would love to talk a little bit about what, the three hormones that we seem to focus on in perimenopause, which are estrogen, progesterone, and testosterone, and what we know what's happening in the brain. So again, seeing lots of women with brain fog, losing their train of thought, anxious, like they've never been anxious before, maybe depressed, like they've never been before, sad. What do we know and what do we not know in terms of these hormones that, for so long were reduced to just being about periods and having a baby?
Yeah, I mean, I literally just read an article. I'm obsessed with hormone research. I just print shit out and highlight it all the time. I'm so obsessed with it. And when people just read it, this is a new article that just came out, and it's like, well, testosterone's main job is male sex characteristics. And I'm like, okay, if you got it wrong on the first sentence of your paper, I don't have a lot of hope that the rest of this paper is going to be good, right? But it's like, dude, nobody thinks testosterone's main job is male sexual characteristics at this point. It helps their heart, it helps their bones, it helps their muscles, right? It's so embarrassing to be like, yes, we discovered them in bull testicles and rooster testicles, but that doesn't mean their main job is to make a man go through puberty, right? Used in making a man go through puberty, but that's not their main job. And I think that's where, again, people think these hormones are for sex characteristics. They help adult bodies become adult bodies. Yes, absolutely. But that's not their main job, right? And I think that going back to the brain is people forget, or not forget, they don't know. We need testosterone and estrogen for dopamine and serotonin. They help make neurotransmitters. They help cells stay healthy. They help the mitochondria. I would say if you make me say what their main job is, oh my God, if you don't have mitochondria that work, you don't have anything, right? So it's maybe that's the most basic thing that they do is they help your mitochondria function, which is the engine of the cell. So it's I think it's wrong when people say if this is primarily for sexual characteristics. Are you still living in 1930? Can you update your knowledge at this point? The receptors are in the mitochondria. That is cellular function 101. But they get dismissed to be oh, they just help you go through puberty.
And so what do we have decent up to date research that talks about hormone therapy and cognitive health?
Well, we have a randomized placebo-controlled trial looking at estradiol patches versus placebo in perimenopause people. They just put them on them preventatively. They're hey, let's see how you do in a year. Off the top of my head, it's nearly a 30% decreased risk of being diagnosed with depression. That seems major. Right? So it's people, that's an argument. It's we don't have a lot of data. And it's dude, 1% of research goes to non-reproductive women's health. Right? So it's you saying there's not enough data, science follows society and cultural, right? And so if you deem women's health not worth studying and then say because we haven't studied it, you can't get treatment, it's not great logic. And I think, again, it's used against women. We don't have great data. Yeah, we don't study women. That's why we don't have great data. So should you suffer over it? Or should we say, let's use what we have and try things to try to relieve suffering? Again, we're here to relieve suffering.
And we're not holding a gun to anyone's head and making them take it either. Like, it's a choice. And if people want to give it a go and they feel better, I mean, that's the thing, I think, in this branch of medicine. I don't know about you, but like over the years, I've obviously, as a general practitioner, prescribed medication of all varieties for all sorts of things. But there's nothing quite like giving someone some hormones and then coming back 4 to 6 weeks later and they're just like a different person a lot of the time. Not all of the time, but a lot of the time. It's like a different person walks through the door. There's not many other medications that we do that with.
Yeah, like people aren't effusively in love with you because you lowered their blood pressure. Right? Like you just don't get that big of a reaction from it. But like, oh my God, I'm sleeping. Oh my God, my relationship's better. Oh my God, I'm not mad at my kids anymore. Right? But are we ever going to study estrogen to be like, does it really help you not be mad at your kids? We didn't study that. But it's like, listen to women. They'll tell you how this helps. Like, how is that not mental health? That is mental health 101, right? Being able to cope with the stresses of your day. Oh my God, that's mental health 101. And besides the fact, if you can exercise now because your joints don't hurt and you can sleep now because you actually have some hormones that help sleep, how is that not mental health?
100%. And if you're not having to have 3 glasses of wine to get through, homeworks and dinner time because you're so stressed out and agitated. I think, that being cranky with their family and their kids is also a really common, and it's often a reason women cry in the consultation. Like they know they're being, grumpy and irritable with people. They're worried that they're destroying relationships in their families. They're upsetting their teenagers. Their teenagers are getting livid with them. They're getting livid with the teenagers. And, it's very distressing. And yet, things like this can be just dismissed as like, oh, well, you're a bit irritable. But it's a really big thing.
It's huge. And then going back to the not feeling like myself, we know hormones help the not feeling like myself. And to me, I'm like, that's mental health. You feeling like yourself, that's mental health. So to say we can't try this because we don't have enough data, I'm like, God, let's look at men for a second. We know men with low testosterone have a higher rate of depression and dementia. Just because we don't have equal science in women doesn't.
We've always been happy before to use the male studies for women, haven't we? So, but now we're not.
That's what's so interesting about testosterone, right? Is like we study statins in men and give them to women. We study antihypertensives in men and we give them to women. We study sleep medications in men and we give them to women. And we're like, but not testosterone, not all that data in men. Can't use that in women. I'm like, that makes no sense, you hypocrites. So yeah, it's very silly. It's very silly the reasons we tell women that we can't help them.
Yeah, 100%. Kelly, I want to talk a bit about, in your book, we really dive into how, looking after women through this transition and optimizing their treatment, it really is about longevity as well. And I'd love you to talk to me a little bit about why you think these things are, and I agree, so inextricably linked.
Well, they help cells function well, right? Like when you go back to, and I think longevity is kind of a buzzword that's starting to like annoy people. It's like, so this was years ago. There's like a fitness person online, and she's like, you can't tell people that hormones make you die less. And I'm like, what's the definition of decreased mortality? Like the definition of decreased mortality is those people died less. Like, you can't say that. I'm like, what can I say then? So there's multiple papers looking at this, and there's nothing like the WHI because it was the largest randomized controlled trial ever. Right? It's a massive study. And again, looking at young people, I might not be able to start hormones in a 74-year-old and have them live any longer. I might make their quality of life better, which I argue is everything, because most things don't make you live longer. Most things don't make you live longer, right? It's very rare. But of the things that make you live longer, hormones are one of them. If you look at the UK Biobank data, UK Biobank said, what are the top 10 medications associated with longevity, longer lifespan? 3 of them were estradiol or estrogen products. So that's telling. So that's very, very interesting. WHI, women between the ages of 50 and 60, on average, 2 years longer, right? Majority because of decreased cardiovascular events. because heart disease is our number one killer. There's lots of different things you can look at as far as and remember, none of us say, I just want to live longer and live shittier longer. Most people don't, when they think about longevity, they don't want that. They want to live longer in good health. And to me, I'm like, that's what hormones do. And worst case scenario, you didn't live any longer. You might have lived better health-wise. Because women live longer than men, but they don't live more years in good health than men. They actually live less years in good health than men. And so, again, relieving that suffering is what we're going to do.
Yeah, I saw an interesting graph recently that showed the decline of men versus the decline of women. And it certainly showed that women have a much longer decline into frailty than men do. And it was really quite confronting. And yet, of course, I can absolutely see from clinical practice that's exactly what it's like. You know, you don't, like, anecdotally, I don't see men falling on the ground and not being able to get themselves back up off the floor anywhere near as much as I see that with my older female patients, for example. So, you know, it's sort of been there in front of my face, but I haven't probably caught on to it until it was spelled out to me.
I'm starting to think, I don't know if this would be annoying or not, so that's why I haven't done it yet, is like when I have a new patient in my clinic, making them get on the floor and then see, because I know some people do actually, this is actually something they measure, and they say like, out of 10 points, you know, how many, did you have to put your hand down? Did you have to use a chair? Blah, blah, blah. But like you being able to get up from the ground unassisted is like directly correlated with like frailty, which is directly correlated with longevity, right? And I notice like when I'm warmed up. So if I do a workout, I'm a lot easier. At the end of that workout, I can get off the ground without using hands. At the beginning of the workout, I can't. Right? It's like, because you're kind of stiff and you're not warmed up. And I think going back, you know, to our previous conversation of like, I can throw an estrogen patch on you, but if you don't do the work and the mobility and the strength and the practice of that, I probably won't move the needle just with an estrogen patch.
My poor mum, who lives in Ireland, who's probably listening to this, she's 76, and I make her, she tells her friends all this, she's like, my daughter has me standing on one leg brushing my teeth. My daughter says that I have to, when she's really into craft and making things, that I have to sit on the floor and do my craft so that I have to keep getting up inside. I want her to last forever. This episode is brought to you by my 16-week Rediscover You program, designed specifically for women navigating the challenges of perimenopause and menopause. If you're dealing with disrupted sleep, mood changes, or unexplained weight gain, this evidence-based program combines medical guidance, practical tools, and a supportive community to help you take control of your health. Women have reported significant improvements in symptom management of sleep quality and overall well-being. As an All About You listener, when you mention the podcast, you'll gain priority access for our next intake. Click the link in the show notes to learn more and join. I'd love to help you rediscover the vibrant, confident version of yourself. Talking about, you know, health span over lifespan, you've got a big section in your book that's talking all about muscle. And it has become a little bit of a standing joke with my patients that, you know, they've got all these new jobs, which include eating more protein and fiber and building muscle, which for many of us, myself included, is a very new phenomenon. Talk to me about muscle and what we know about muscle and why it's become such a big part of the conversation and probably really never was before for middle-aged women.
They're just absolutely sexy. Like muscles are like the sexiest things ever, right? But I think they get downplayed because they've always just been like aesthetic, right? Like, oh, they put in a lot of time, or even associating like having muscle with like being stupid, right? Like the meathead, like how horrible is that reputation? But muscles are like, nobody's in charge of muscle, right? Like there's what doctor group is in charge of muscles? Like nobody's in charge of these things. So I think that's another reason why they've been so downplayed. The other cool thing about muscle, unfortunately, I wish it wasn't true, you just can't buy it. You can't just buy yourself some muscle. Like it's literally work. And I think that annoys people. But also when you see somebody with muscle, you're like, I know what that takes internally to do that. Like it's a measure of somebody who's willing to like show up for themselves. Again, that's why it's super sexy, right? They're a glucose sink. They help with insulin resistance. Exercising the muscles send myokines, which are basically like muscle proteins, to the brain, which helps the brain's neurons make new connections. Like muscles are literally brain stimulating. And there's a huge correlation with muscle and frailty in your risk of dementia. And the other thing is like, can you start at 74 to get muscle? Absolutely. It is never too late. Start now, get a trainer so you can learn proper form. But the sooner you get on that train, the better it is, right? Because we're aging. Hormones don't change the fact that we're aging, right? And it does get harder. We get more catabolic as we get older. So you got to eat, because people with me and testosterone, they're like, do you just think women are going to get muscles if you give them testosterone? I'm like, no, they have to eat and they have to move their muscles. Like, testosterone will help because it's a building block, helps mitochondria, but you can't get muscles just with physiologic dose testosterone.
So for anyone listening, what do you mean by you get more catabolic?
So catabolic means breaking down, anabolic means building up. So in our youth, because we're growing, right? We're growing and then we're going through puberty. Those are very anabolic states. Our body's building. I say, like, everybody with kids is like, our kids can like build bodies on carbs, right? Like we can't, but they can because they're so anabolic, right? They got a lot of growth hormone. They've got a lot of things that are like building, repairing. Kids heal, in medicine, like, oh my God, kids heal so well compared to like a 68-year-old. Right? They're anabolic, they're building, they're repairing, they're growing. And that stops in your 20s-ish, right? And you can still repair and you can still build, but you become more catabolic, which is breaking down as you age, right? Your body's just not as resilient. So one thing that really helps is exercise, because it's like telling the brain, hey, grow. Hey, keep making memories. Hey, keep doing all this. And then you lifting weights, it's like, hey, bones, grow. Hey, muscles, grow. Where they're going to do that kind of by themselves if you've got a 9-year-old. But when you're 45, you got to provide more of a stimulus.
Yeah, I think you're right. I think a lot of us, and doctors included, we've nearly thought of muscle as just being like, I don't know, a big piece of steak that just sort of sits there and gives you a bit of strength. But I think more and more we're beginning to understand that it is so tied into metabolism and glucose and insulin and everything. And one of the things that women often seem to have a hesitation about starting to do strength training are two things. One, they feel intimidated. They don't know what to do. And also they're really scared of hurting themselves. So they already maybe have a sore neck, or they've already had a frozen shoulder, and they're really scared that it's going to make something worse. And then the part B of that is they're really worried that they're going to get bulky. And I'm kind of like, do you understand?
You realize the men laugh at us for that, right?
I know. It's like, do you know how hard it is to get bulky?
Because the men are like, we wish we could get bulky. And the men have like testosterones of 700. We wish we could get bulky and we can't. Like, you guys, good luck. You've got a testosterone of 40, right? So I like it that the men laugh at us for thinking that, because they know how ridiculous it is. Because for men to lift weights and get bulky is still very hard.
What would you say to someone listening who is just like feeling intimidated and they don't know where to start? What would you say to them to try and convince them that they really should step outside their comfort zone and try and do this?
Well, I mean, how do you want to live? You want somebody wiping your ass when you're 73? Like, there's no, I could sugarcoat it. But at some point, it's like, movement is everything. Movement is everything. And now your brain is telling you things that are keeping you from moving. Is that acceptable to you, or do you want to figure that out? Right? Like, join a group, get a coach, do an online course. Oh my God, there's so much stuff on YouTube, right? Like, even if you have like no money, you can move your body. That's what's so beautiful. Going back to what I said, you can't buy muscles. You can do, they're free, but you got to work them. And so, I would also say, like, that's what everybody thinks. Like, that's a normal thing to think when you're not into it. And then you look at the 73-year-old bodybuilder and they're like, I just started figuring it out. It's like, you can figure it out, but you must prioritize aging, your health. And when I ask women, like, who do you want to be when you're 74? What do you want to be doing? Do you think not exercising is going to let you be that person? The answer is no.
It's got to be a active self-care in the end, that, actually putting your body first so that you can not end up in the nursing home. That's my plan.
Yeah, I mean, it does. And I think without that, I just did this amazing conference in Orlando, and like everybody's like, what's your one takeaway? And I'm like, love, man. If half of the women on this planet loved themselves, it would be a different planet. Like, why not start with you? Figure it out. If you loved yourself, how would you treat yourself? Okay, there, do that thing.
Yeah, I think that's right. And I think so many women, they'll do anything for their kids or anything for their partner or anything for other people in their family, but they definitely struggle. And it's probably a cultural thing that you just have been absolutely brought up to put everyone else first. And, a lot of women will say, but I just don't have time. I don't have time to do it.
This thing is like, you don't have time to get frail, right? So you better be exercising. And somebody, again, going back to the conference, somebody was like, go to the gym and lift heavy for your kids, because you, to the best of your ability, don't want to be a burden, right? So like, even if you're so fine, do it for your kids. Like, that's a great reason to be healthy. Don't use it as an excuse not to move, though.
Yeah, absolutely. Well, I often say to my patients, you want to be able to do a few things. One is get yourself off the floor if you fall down, like we've already said. You want to be able to get yourself on and off the toilet by yourself. And you want to be able to get yourself in and out of your kid's car when they come to pick you up and take you out. So if you can aim that you're still well enough to do all those things, then I think you're on to a win, because nobody wants to be just sitting in a chair all day.
Yeah, and I think what a lot of people don't know is movement actually helps pain. Like the body, an amazing book for anybody who wants to read about this is called The Comfort Crisis, about basically how we're not moving our body, and we have more problems because we don't move our body than problems because we move our body. And people are like, I might get hurt moving your body. Well, you're going to get hurt not moving your body too. So you pick.
Talk to me a little bit about what is going on around perimenopause, when we're starting to see cholesterol starting to climb in women. Lots of women come in, they get really upset. They used to have like a perfectly good cholesterol. Suddenly it's high and they're like freaking out and really worried. Can you explain a little bit to the listeners what is going on with cholesterol, arteries, hearts in this time of life?
Yeah, so perimenopause, it means the fluctuating changes of hormones before no hormones. Right. So people think perimenopause is like, they're like, what is it? And it's like, well, it's reverse puberty. Some people call it the zone of chaos. Basically, it's your body outliving ovarian lifespan. Right. So you were seeing declining hormones. Fluctuating hormones is more accurate, because sometimes you get spikes, right? Because the ovaries, again, they're trying to do their job. They're just starting to get bad at it. So the body's smart, right? The body wants to try to have backup plans for things. And I like to think of it that way, because it's a lovely way of thinking why the body's raising its cholesterol. So estrogen and testosterone are made through the cholesterol pathway, right? So we make a cholesterol, which is a steroid, and then you cleave some carbons and you end up with testosterone. Then you cleave another carbon or two and you get estradiol, right? So that's how it works. And so when the body sees less estrogen, it can't make any more, because the ovaries they're only a certain size. There's only so many packets of eggs and hormones, right? And we outlive that. We have enough years that go by, but we run out of packets. So the body's like, these hormones are important in everything. Let's see if we can make some more. So the body tries to make more hormones, and the body increases its cholesterol to try to push more hormones through the cholesterol pathway. And the other thing the body does is it hangs on to fat more. It prioritizes visceral fat, because fat actually makes crappy hormones, but it makes hormones, right? They're just crappy. They're the inflammatory hormones. Nothing's better than the hormones your ovaries are making. So the body has these compensatory mechanisms to try to get more hormones in the body, but the compensatory mechanisms have side effects, right? Too much cholesterol, too much visceral fat, bad for inflammation, bad for cardiovascular health. So I like to think of it that way, though, because I think the body's trying to get what it needs. It just has like the B team doing it now, because it doesn't have the A team anymore. And I just think that's a much more beautiful way of thinking about it than like, the body's falling apart, blah, blah, blah. No, the body's wise. It's trying. It's trying to do what it needs to do. It's just using poor compensatory mechanisms versus nothing. And women are like, oh my God, nobody ever told me that. You're like, well, it all makes sense then. Because they're like, it's a mystery. This is not a mystery why these things go up when your ovaries go down. It's not a mystery at all. People just don't know about their bodies. They don't know the role of hormones. They don't realize how important the hormones are so important that you make more cholesterol and visceral fat to try to make crappy hormones when you run out of ovary.
And so what about women who then come in and say, I'm going to go and get put on some cholesterol lowering medication to help with this high cholesterol? That's a counterproductive thing to do.
Well, it lowers cholesterol. Didn't solve the problem of why the cholesterol went up in the first place. You're just trying to put a lid on the compensatory mechanism.
And so to take it a step further, why then after menopause do women's cardiovascular disease risk seem to just suddenly accelerate quickly?
Estrogen works on the heart, right? Number one reason women go to cardiologists is heart palpitations, which is because there's estrogen receptors in the sinoatrial node of the heart. And now the heart's like, help, I don't have what I needed to like beat regularly, right? But women go to the cardiologist, they get the Holter monitors, they get their labs, and they get told, hey, everything's fine. We couldn't find anything wrong with you. Thank God you don't have a heart problem, but you still have heart palpitations, right? They're not being treated. So estrogen works in the cardiovascular system in many different ways. So does testosterone, right? Women with the lowest quartile of testosterone have more congestive heart failure, more hospitalizations before heart failure, right? So both of these hormones they work in the arteries and the blood vessels and the electrical conductivity, all these different things, let alone inflammation goes up, insulin resistance goes up. That's a cardiovascular risk factor, right? Like the health of the lining of the blood vessels is affected. So, I mean, it's really, again, it's not shocking that hormones affect everything once you realize hormones help healthy cells be healthy. They work everywhere.
Yeah, 100%. One of the last big topics, I think, is sleep. And it's definitely a very high reason that people come to see me. And it's probably one of the things that I do prioritize first and foremost, because I think when you get someone sleeping, they see the whole world differently in so many aspects of their life. Like you're so much more likely to not be irritable, or so much more likely to want to like your partner, or you're so much more likely to go and exercise. Yeah, 100%.
Insulin resistance, beta amyloid goes up in the brain after one night of sleeping crappy.
Yeah. So talk to us, because I know you're the research girl.
Just in case you want to shock anybody with that. I took a red eye to my conference. I had like 2 hours of sleep, and then I hung out with like a PhD in neuroscience. And she's like, did you know that beta amyloid goes up in the brain after one night of not sleeping? And I'm like, my beta amyloid's high today.
Well, I actually just listened to a really interesting podcast, and they were talking all about sleep and how you can actually sleep bank. So if you know that you're going to have, for example, like you, then what you should have done is for a few nights before, you should have banked a little bit of sleep, and that can actually help. But you can't do it afterwards. You can bank it. And they've done lots of research, and they show that people who banked a little bit of sleep before sleep deprivation, I think they actually studied doctors, had less of a reduction in their ability to process information, etc., than the group who hadn't banked some extra sleep beforehand. So there you are. Next time you need to have a few hours sleep before you have a red eye flight. But let's talk a little bit about sleep and how it influences longevity and well-being.
Yeah. Well, if you don't sleep, you die. We kill people that way, right? We kill people that way. We kill animals that way. Sleep is when the brain heals itself. It's basically cleaning itself. So I'm by no means a sleep expert, but I know this: hormones help people sleep. And if you're not sleeping, and say you're on a good amount of hormones, you've got other things treated, and you're still not sleeping, women have a much higher rate of undiagnosed sleep disorders, sleep apnea, right? And so that's what people just want to keep pushing the hormones to sleep and sleep and sleep. Is like, no, there could be a lot of other things going on too. That's when we say sleep study, sleep expert, because sleep is so important, and hormones will move the needle, but hormones aren't everybody's answer.
100%. I'm so glad that you said that, because I think sometimes my patients are leave my office and they're like, oh, I seem to be going for a sleep study and I seem to be going for all these things. But, I see a lot of women who are starting to snore. And if they bring a partner with them, the partner will often tell me, yeah, I definitely feel this person's stopping breathing. So we need to go and make sure that we get that sorted. Kelly, I want to talk to you now finally a bit about sex, joy, pleasure, and how that is also all tied in with longevity as well. I know that you have, and I've listened to a couple of times, your incredible TED Talk, and you also have a course especially for adults on sex education. I'd love to know how you decided to get to that point where you thought, I'm going to have to make a course about this. Talk to me about that, and talk to anyone listening.
Yeah, I mean, we all got here because of sex, right? Like, that's what's so crazy about it. It's like, you wouldn't be here if sex didn't happen on that very specific night that it happened. Like, it's kind of a miracle when you think about it. I got into it because a patient was crying in my office because of her sexless marriage, and I didn't know how to help her. And so I just became obsessed with it when I started realizing, like, we actually do have science, we actually do have data. It just doesn't get trickled down into society, and Hollywood certainly is wrong on its sex education. And a lot of adult sex issues are because we just didn't get a good education in the first place. And most people don't need medications, and most people don't need a sex therapist. Like, we just need a basic sex education of, like, your body's here to provide pleasure. You just never got taught, and you never got permission to try to figure that out. And so many people are like, oh, had I known that, I'm good. Right. And so it's like, you always start with education, knowledge. How does your body work? Oh my God, putting something in your vagina just doesn't lead to orgasm in everybody. No, it doesn't. So we don't have orgasms when we put in tampons often. Right. Like, vagina is close to the sexual organ that offers orgasm, but it's not the thing. Most people don't know that. Right. And so it just became this, like, oh my God, there's so much lack of knowledge. There's, again, so much suffering because of lack of knowledge. And, the 10-minute doctor appointment doesn't help, because doctors are trying to offer solutions to a very sensitive subject very quickly. And that often looks horrific. Like, oh, just relax, get a new boyfriend, drink a glass of wine, just use Crisco, just grin and bear it, just blah, 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 just try porn, try erotica, blah, blah, blah. So, like, they're throwing suggestions on something that's, like, so vulnerable, so challenging. Many people have suffered sexual trauma in the past. Like, that needs to be addressed, right? So it's a big topic. It's a fascinating topic. It goes into gender roles, ageism, who's allowed to have sex. Certainly not old people with disabilities. We put so much stigma on, like, who's allowed to have sex. And I'm here to tell you, like, I've got patients in their 70s. They're having the best sex of their lives, but it requires knowing that that's possible. And because if you just listen to Hollywood, only the 22-year-old good-looking people are allowed to have sex, right? So it's, who you see represented matters, I think, in all areas of the world, but certainly with sex. So I got obsessed with the topic. That's what my first book was about. That's how my podcast, You Are Not Broken, got started, was just to be like, lube's amazing. Try it. Like, simple stuff like that.
Yeah, amazing. And I mean, it's definitely, again, a very, very common presentation to me at the clinic are women who are really concerned about their relationship. They're feeling really guilty and they're feeling upset. And probably for two reasons. One, they'll say, if I never had sex again, I wouldn't care. Like, I just don't, I have no interest. If you told me I didn't have to do it again, I'd be quite happy. And then we have another group, I suppose, who may also feel like that, but it's also extremely uncomfortable for them to have sex. And it's something that is not shared with friends because they feel embarrassed, and they're often not even completely sharing it with their partner as to just how bad it can feel for them.
Yep. So for the first group, and the people who are like, if I never have it again, I always ask them, was it ever good? Right? Like, was it ever good and now it turned gray? Or was it never good in the first place? Because those are two very different scenarios, right? Like, if you've never enjoyed sex, why would you enjoy sex? It was never pleasure. So you got to work on making sex pleasurable. You will never desire something that's not rewarding to the brain. That's the dopamine pathway. That's how it works, right? And then if you have pain, well, you're never going to want to hit your thumb with a hammer, right? So women will be like, I have low desire for sex and pain with sex. I like to take problems away from women. I'm like, no, you have one problem. You have pain with sex. You'll never desire that, right? We can't even work on the desire until you fix the pain. And then for the other group of women who are like, sex used to be amazing and now it's not. That's very different than sex was never amazing, right? So I think about that. And so that's when I'm like, okay, what's going on with your hormones? What's going on with sleep? What's going on with stress? What's going on from this used to be amazing? Like that person knew how to have an orgasm, how to enjoy the orgasm, orgasmic equality, all the things. And now it's not good. Okay, now I'm thinking about hormones and blah, blah, blah. But if you just throw an estrogen patch on somebody and they've never had good sex in the first place, don't expect the hormones to work. So sex is biopsychosocial. It's incredibly complex. That's what makes it so fun. But it's also what makes it so difficult in your typical 10-minute doctor-patient relationship.
Yeah, 100%. It's so complicated. There's a topic that has sort of gone viral about disappearing labia. There's been videos all passed around the place. So many patients coming in. Lots of sometimes the comment sections on these videos are absolutely hilarious. People having pictures of labias flying away like butterflies and things. So can you please explain what is physically happening? Because so many women come in and sort of by the end of our conversation, they're kind of giggling and they'll ask me, what is actually really going on? Are bits of me dropping off? Where are they going, etc.? I am being a little bit facetious, but can you kind of give us the truth, Kelly?
Yeah, fair enough. So adult bodies become adult bodies because of hormones. Right? We didn't have adult genitalia when we were 8. We went through puberty. Now we have hormones on board. Now we have adult genitalia. When those hormones go away, meaning we outlived our hormone production, the adult genitalia don't have what do hormones do? Hormones make cells healthy, right? So the hormones are gone. So the clitoris can shrink, the labia can resorb. They don't fall off, but they just disappear, right? The body's like, I don't have what I need for these cells to be healthy anymore. So they go away. Labia are important for 2 reasons. Number 1, they're erectile tissue. They're very important for arousal. But number 2, they protect the vagina. They protect the urethra from irritation, invasive issues, probably infection, right? So when they go away, less pleasure with sex, but also more prone to vaginal infections. Vaginal estrogen, vaginal DHEA, all incredibly important. If you want to live past your ovarian hormone production, which we all want to do that, we then get to make the choice of helping our bodies stay healthy by using hormones to help them. And that's local vaginal estrogen or local vaginal DHEA, intra-rosa. It's actually way cheaper in Australia than it is in America. When I was there, so many more people were on vaginal DHEA than in America because it's like half the price in Australia.
I think it's like $40 here, so it's so good.
Yeah, it's fantastic. Good Lord, it's fantastic. If I could get that for $40 here, it's so good. But yeah, I saw somebody, I did a reel on somebody's podcast, and now it has like a clip of the reel on Instagram has like, it's almost 4 million people. Like, I think the question is like, does the vagina go away after menopause or something like absolutely ridiculous, right? But it was something somebody wrote in, like, I hear the vagina goes away. And I'm like, the vagina is a tube on the inside. It doesn't go away. You're probably talking about the vulva, which is the external structure, which just tells you like people's lack of body knowledge, right? So like the vagina does not go away. But the vulva can profoundly. Why do people stop having sex after menopause? Because the vulva hurts, right? Because the cells aren't healthy anymore. And so, it gets like ridiculous amounts of clicks. We're like, hey, you can die more because of heart disease. They're like, whatever. Tell me more about the labia.
So if someone was to take a picture or look in a mirror before and then 10 years later, what looks different?
Yeah, labia minora goes away. The hair on the labia majora can go away. The clitoris, head of the clitoris can atrophy. The clitoral hood, which is the turtleneck, it's equivalent of male foreskin, right? So that can get stuck or attached. So it's called phimosis. So you can't expose the clitoral head as much. That can be a profoundly, number one, pain, number two, decreased sensitivity or pleasure. Irritation to the urethra, burning when you pee, recurrent urinary tract infections. Like, this is all called genital urinary syndrome of menopause. It's incredibly common, 50 to 80% of women. I just read somebody's comment on the like 4 million posts. Somebody's like, mine didn't go away. And I'm like, well, good for you. Thanks for sharing. That doesn't mean other people's don't go away, right? Like, we're not all Toyotas. We all have different experiences. But yeah, somebody's like, mine didn't go away. I'm like, okay, good. But the thing people don't know is the longer you live with no hormones, the more progressive it can be. So why not give yourself some hormones? If labia disappearing is the thing that puts you on vaginal estrogen, like, God bless, but you'll probably also have less bladder leakage, less pain with sex, less urinary tract infections. Like, it's all GSM. But people are so shocked because of their lack of body education.
Yeah, absolutely. And in terms of what happens to that whole pelvic floor sling whenever you're de-estrogenized as well, is there something changing within that muscle?
So both testosterone and estrogen, right, help promote lean body mass. We don't have great studies, but we have 2 studies showing an association that women with the lowest amount of testosterone in their body have the most stress incontinence, leaking with cough, sneeze, laugh. Right. When does prolapse happen? The relaxation of the pelvic organs through the pelvic bowl after menopause, when the hormones go away. We lose muscle strength, right? Catabolism, the breaking down process, right? That happens more. Prolapse, very fixable, but nobody wants pelvic floor prolapse. Like, it's not a good time. Pelvic floor physical therapists are amazing. And often it's getting your hormones back on board, getting your strength back on board, right? Women with better hand grip strength have less stress incontinence, because hand grip strength is a marker for full body strength.
Yeah, I'm really lucky. I've got 2 pelvic floor physios that work at my clinic, and it is amazing. And they are so busy all the time. But so many women are convinced that just a little bit of leakage is normal. That's to be expected. And they kind of just put up with it all the time, which is kind of frustrating, because
it's amazing how much better it gets. Right? Because people are like, blah, 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 it is how it is, blah, blah. I'm like, dude, you realize for a lot of people, it gets a lot better with PT.
Kelly, one of the last things I want to talk to you about is that all this education is definitely out there. The information is getting out there. You've got, millions of people following reels that are reaching so many people. And yet there are still a lot of women who are sort of terrified at the thought of going into perimenopause and menopause. They're really scared of it. And then there are other women who are still like, la, 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 this is not happening to me. How do you think that we present the facts without making people so scared and terrified that they just go into some kind of denial about the whole thing?
Yeah, well, I think, it's kind of portrayed as this awful thing, right? And I have a chapter in my book about this. It's like the midlife mindset of like, dude, this is an actual amazing opportunity to dial it in and to start choosing you and to start saying, what do I want to do in my 80s? And what can I do now to get me there? And what can I do so that when I'm in my 80s, I'm insanely proud of what I did now for that? Whether that's re-evaluating your relationship with drinking, whether that's prioritizing sleep, right? And people pick on us all the time because we prescribe hormones. Like, we have profound experience with that nobody else has. If you're not a prescriber, you don't know. You don't hear these stories. So I think we get this reputation of like, you just want everybody on hormones. It's like, no, we have profound experience with that, but that's not all there is, right? And so to realize, like, coming from a place of education, of like, at the end of the day, we are all pretty interested in these meat suits that we got to walk the earth with, and like, we could take care of them. We could take care of them and help them. Maybe they won't hurt as much. Maybe they'll get us off the toilet when we're 74, right? And so, like, by no means is it doom and gloom. Like, there's nothing I love more on the internet than like puppy videos and watching 80-year-olds like squat heavy shit. like those are like my cat video equivalents. Like I love it because most of these people, they weren't squatting heavy when they were 23. They came into it older in age. And you see what they do and you're like, this whole thing of like frailty is inevitable and aging is pain, you realize that's a cultural made up belief system that can be changed. And it's profoundly optimistic.
100%. I saw a lady the other day finishing an Iron Woman and she was 92. 92 and she just done an Iron. Like, that is insane to me, but so cool and very motivating.
So cool. I'm telling you, I'm gonna have the coolest tennis shoes. When I'm 95, I'm gonna be like, these are my Monday tennis shoes. These are my Tuesday tennis shoes. It's like, I just want all the good tennis shoes. Why not? I'm a stylish old grandma playing pickleball. Like, around a pair of like bright yellow Adidas. You know, it's like, dude, rock it. Just as far as we know, there's one go.
Absolutely. I think the other thing I would say is that once we get women feeling comfortable and we get rid of a lot of the symptoms and they begin to feel like themselves again, I find that women in this era actually like themselves more than they probably have in their whole lives. And they're a bit more sure of their opinions. They're a bit more sure of what they want and they're ready to go for it in all sorts of things. Like, I've got so many patients who've started businesses or written a book or gone off on a retreat and learned something new. And so I think I don't want this era of life to be framed as this really negative thing that's just hell on earth. Because I actually don't see that. I see the other side of it too, where people are just actually, kicking goals left, right, and center. And I think even when you look at, a lot of the very famous menopause doctors online, like yourself and Marie Claire and Dr. Vonda, like, none of you were well known whenever you were in your 20s or 30s, but you're out there kicking goals, writing books, doing world tours, all the things. And I think it's really liberating to have that feeling that that's a possibility for you.
Yeah, totally. And like, we're all doing it because we see women get better, right? And we see women, like we always say, we change the world by making women feel better so they can go out and change the world. Like, this is a ripple effect. And so, every once in a while people will be like, you're a scaremonger. And I'm like, I think I'm like ridiculously optimistic. Like, I'm like, dude, even the term midlife is ridiculously optimistic, right? And so it's like, even thinking that this, like, it's all like, work on our thoughts, work on your beliefs, right? Like, there's so much to be great. The fact that the average life expectancy is nearly 80 now, that has never ever happened in the history of humans. In 250,000 years, that's never happened. Like, that's profoundly optimistic. You just have to know what to look for.
So, very final thought is, what does the woman who is feeling like she's beating her head up against a brick wall, she's maybe not got a lot of choice, so not everyone has a choice of going to see lots of different doctors. How do they get their doctor a bit more on board for this? What would your tips be?
Oh, bring them in podcasts and bring them in books, sharing information, right? And even if the doctor doesn't read it, they know that you care about it. And like, people love, like, a book is a gift, my friend, right? Like, people like getting gifts. And if it's a gift of how to help women, because at the end of the day, doctors want to help women feel better. They do. And if you get the feeling that they don't, maybe get a second opinion if you can, right? But like, lots of people bring their books in, bring papers in, bring podcast episodes in to try to say, like, this is where I'm coming from. This is what I'm learning. Can we try something?
Yeah, I've had some patients recently tell me that they did exactly that in to an oncologist. I had one bad story, but the rest actually was really positive. And at their next appointment, the oncologist had said, I've read the book, I've gone down a bit of a rabbit hole, and I'm here for having this conversation now, which was just such an amazing outcome.
Love it.
So, final thoughts, Kelly, anything that you would love the listeners to know that you're just feeling like is not getting out there?
Oh, I think we covered it, man. We covered a lot. Sleep, alcohol, exercise, mindset, right? When people are like, oh, it's only about hormones. No, hormones help cells stay healthy. but you still got to do all the other things, which again is profoundly optimistic, right? There's so many ways to move the needle that it's just like pick one, practice at it. Like I'm still working on my diet. I'm still working on fitness, right? Like there's no there. You just keep trying, keep learning, keep going, and adjust as needed.
Are you coming back to Australia anytime soon?
I'm currently in negotiations. We'll see if where that goes.
Okay, amazing. All right, thank you so.
You'll be like the third person to know that.
You better. Thank you so much. You're amazing.
Thanks for having me.
Here are my 3 takeaways from today's episode with Dr. Kelly. Hormones shape your long-term health, not just your symptoms. Estrogen, progesterone, and testosterone influence the symptoms that keep you well: your heart, bones, brain, metabolism, and mood. Understanding your hormonal health is part of protecting your future self. Muscle is medicine for midlife. Strength training, sleep, and daily movement are the foundations of healthy aging. Building and maintaining muscle isn't just about fitness. It's about mobility, cognition, metabolic health, and independence in later life. Joy, intimacy, and connection are longevity tools. Pleasure isn't frivolous. Healthy relationships, emotional closeness, sexual well-being, and a sense of joy all have measurable impacts on brain health, stress physiology, resilience, and lifespan. Dr. Kelly, thank you again for helping us see menopause as a springboard, not a slowdown. You'll find links to the menopause moment in Kelly's podcast, You Are Not Broken, in the show notes. If this resonated, please follow the show and share it with a friend. And remember, this information is general in nature and not intended to replace personalized medical advice. Always speak to your healthcare provider for guidance about your own situation. I'm Dr. Shauna Watts, and I'll see you next time on All About You.